Today I'm going to show you my favorite exercise for fixing a high foot arch and restoring the mobility and function that it's lacking in order to help you feel and move better. A high arched foot tells us a couple of things. Usually that the foot is lacking the ability to move into pronation and dorsiflexion effectively. A high arched foot represents a supinated position of the foot. Supination is paired with external rotation of this tibia bone right here. So as this tibia were to rotate out like that, it would pull the foot arch up with it. As it would move into internal rotation, it would flatten out the foot arch. A high arched foot is paired with external rotation of the tibia. So if I were to turn the tibia out like that, that would raise up the foot arch. As I were to turn it in like that, that would lower the foot arch. If you can't get your foot to pronate properly, this creates a lot of potential issues. Namely that we can't move into internal rotation of the tibia, but this feeds all the way up into our hips and even potentially our upper body to a certain extent. Because imagine that when you strike the ground and you move into mid stance, where the other leg is off of the ground and you are loading your body weight onto this stance leg right here. If your foot arch can't yield into the ground, you will not be able to properly shift into that side of your body, which can be very problematic for getting us to properly shift in and out of our hips. If you can't properly shift into your hip, then where are you going to shift into? Probably your low back or putting too much stress on your knee. So we need to be able to properly get the foot arch to drop, and we need to do this in a healthy way without risking overly collapsing the entire foot. Because a lot of times people with a high arch foot go, okay, I just need to learn how to pronate my foot better, and they end up pushing it too far and they end up just learning how to dump their whole foot in. I would rather give you an exercise that naturally will facilitate healthy pronation and strengthen the muscles that will help you get there. The muscles we really want to feel in this upcoming exercise are the perineal muscles. These muscles are on the outside of our shin and our calf. We want to make sure that these are working because what these do is help guide the transition of the arch down to the floor and then allows for subsequent healthy amounts of push off where we go back into a supinated position. So after doing this exercise for about 3 sets of 30 seconds, you should be able to walk around and notice that you are naturally on the inside edge of your foot. This is the Hauser pronation isometric. What we're going to do is get a wedge. 15 degrees is what we find works well here, and a wall that we can lean up against. It also helps to have a PVC pipe. It's just going to give us a little bit more external stability, but you don't have to use one if you don't think you need one. Now, we have Jacob's foot set up so that way his foot is slanted and the bottom side of his foot is on the lower part of the wedge and the big toe side it is on the upper part of the wedge. Now, the important thing here is that we're going to get our big toe lifted off of that wedge, but we need to keep our first metatarsal head down. So that's going to be our point of focus. Then we're going to have the knee go over the second toe, not collapsing in, but going over the second toe. You want to make sure your knee gets at least in line with your toes or just a little bit past, but you don't want to go before that because that won't be enough dorsiflexion. And then you want to lift your heel off of the ground and that other back foot off of the ground. So what you should feel is muscles on the outside of your shin and ankle working here as you keep your focus in that first metatarsal head right there. You're just going to hold this for 30 seconds to start. There's a couple things to look out for here, especially as you start to get tired. The first is that you're going to have a tendency to lose that first metatarsal head and slide to the outside of your foot. Keep your weight in that big toe with the intention to keep the big toe lifted. Some of us won't be able to actually lift the big toe, just have that intention. If you can't do it, you'll still be getting a lot out of this. The other thing is make sure your pelvis is nice and neutral and it's not extending or rounding. If it was a bowl of water, you want it to be neutral with the floor as much as is realistically possible for you. And the last thing is that as you start to get tired, you're gonna have a tendency for that knee to want to translate back, so keep it forward in line with the toes at least. If you like this type of approach, check out my Lower Limb Foundations program. It's designed for pretty much anyone to be able to do, and it helps improve common weaknesses and movement limitations of the foot and the lower limb up to the knee, and even incorporates the hip. Because as this video is touched on, you can work on the foot all day long. You can work on the hip all day long. But if you're not appreciating the other structure, you're always going to be limited. If that variation was too challenging for you, I have a regression, and this is how I would get people started and build up to this before going to the first variation. So we're going to get far enough away from a wall to where we can almost do like a side plank on a wall where we have our elbow at shoulder level. And so that way when Jacob leans into that, he already feels a little bit of side abs on the side closest to the wall. And that's also going to allow us to feel the inside foot arch on the side furthest away from the wall. So that would be the first metatarsal head and the inner heel on that side. Your outside foot's going to come off of the ground a little bit, and that's okay. Just make sure you're focused on those points. In this case, his right foot here. So Jacob can lean up against that wall there, and now he's going to focus on those 2 points in his right foot as he keeps his leg pretty straight with a very, very soft bend in his right knee. Just like 5% is all you're looking for there. And then he's going to lift up his left hip to the point where it is comfortable for him. He doesn't want to feel too much pinch in his hip. And then he's going to just very slightly side bend to the left side. So it's like he's dropping his left shoulder and raising up his left hip. He's going to feel some side abs. Now, he should feel maybe some muscles in his right calf and outside hip and his left side abs working. He's going to sit there and breathe in through his nose and out through his mouth. If this is easy for him, the progression would be to just ever so slightly lift the heel on that planted side off of the ground. Just a couple of millimeters or a couple centimeters is all you need right there. You should feel a lot more right calf working. And then you're focused on the right, in this case, first metatarsal head. If you notice a difference, please do me and the channel a huge favor and smash that like button. It really helps the channel grow in the best way possible.